Okay, so we are going to be clamping and cutting the umbilical cord. So we've got our baby here with the umbilical cord. Other supplies that you're going to need. You're going to need your clamps. So you can either use 2 clamps, or you can use a clamp and a hemostat, or you can use an umbi ring, which is like a band, a rubber band that will collapse on the umbilical cord. So we've got these 2 hair clips here that are going to be representing our umbilical clamps. You'll need a pair of sterile scissors. So I've got my little faux sterile pouch in here with the scissors. Some gauze. So I've got this washcloth that's going to be representing our gauze. And of course your gloves. So whenever you are dealing with the newborn, you are going to want to be wearing gloves. So putting on our gloves. So we're going to wait at least 2 minutes after delivery to do any of the cord clamping or cutting, as long as we can. I typically am going to wait until the golden hour is done, unless something weird is happening. Typically the blood is not going to drain from the baby to the placenta once the placenta is delivered and the cord is done pulsing. It's done. So we've got our sweet baby here. We're going to clamp the cord in 2 places. So there's clamp number 1 about 2 finger widths away from the belly, so that it's not too close, and then we're going to clamp again here. So typically I would have someone opening my scissors, or I would have my sterile pouch open so that the scissors are staying sterile for me. But this is not a friendly sterile pouch opening. So we're going to take the gauze here and we're going to place it underneath the umbilical cord. This is going to help prevent any splattering and to catch any blood so that it's not getting on baby or on sheets or anything else. If you are having a parent or a sibling or someone is assisting you with cutting the cord, you will want to tell them that the umbilical cord is kind of gummy, or it's like cutting a really thick rubber band. So it is a little bit difficult to cut. So we're going to go ahead and we're going to cut the cord. It's going to take a couple of snips to get through that. And then you want to place your scissors away. If you have an assistant, then you can hand them to your assistant and allow them to take care of them. And then you'll just dab away the blood, and you'll take the cord and the placenta and take care of that later. And now you've got your sweet baby with their clamp. So you can trim that so that it's a little bit closer, so there's a little less to deal with, but you cut baby's umbilical cord.